Hello, all. This is Dr. Dheeraj Masapu. I'm a senior consultant in the field of neuroanesthesiology, and today I'm going to cover medical specialties where you have a very good work-life balance and also a very good patient interaction. So I'll tell you the reason behind doing this particular video. One of my senior colleague actually asked me, he wants to get his daughter into medical specialty. He asked me, he wants a specialty in such a way she should have a very good work-life balance. At the same time, she should have some kind of patient interaction so that she will have a good name in the society. So they are from a tier 2 city. So this is the kind of requirement he had, and this video is particularly for him. And and not only him, and many women in this country. I think if you really don't want night duties and if you want a good family time, and then these are the specialities I think you should opt for. And not only women and even men can take. Okay, let's dive into the specialities. So number one, anybody can do a blind guess. It is dermatology, where you get patient work-life balance and also patient interaction. And the reason being, in all the specialities, one thing is in common: night duties wouldn't be there. So that is the prerequisite. So in dermatology, night duty wouldn't be there. And you can see here a balanced lifestyle will be there and a very good future scope, because a lot of people in the young age and having good income would want to go to aesthetics, and a lot of procedures would be happening in future. So how many are there in this particular country? So for that I did a small research, and in all the societies I calculated around 11,000 dermatologists are there in India. And but actual number will be slightly higher than that. Maybe 12 to 15,000 dermatologists would be there in India, which is very less. And in future, the predicted number of people who would be having dermatological disorders is very high, around 1.5 crore people. That is 150 million people can have dermatological disorders. So because of that, the demand for the specialist will be there surely. It will not get saturated so easily. So if you want a good work-life balance and good patient interaction, this is the number one specialty that you need to consider. So let's go to the next specialty, that is ophthalmology, where you have a work-life balance and you don't have night duties, so that you will have a good balanced family time. So here looking at, if you want to know how many ophthalmologists are there in our country, the number is a little higher than dermatologists. The number is around 25 to 30,000 at present. This rough number. So the deal, cataracts, glaucomas and everything. And what is happening now is the number of people who suffer visual impairment is going to increase, and many people would require regular eye care in future. So the requirement of ophthalmologists would be increasing. But usually what happens is, in ophthalmology, a lot of eye foundations are there, so bulk of people would be going there. And I also see a reason behind that. See, in ophthalmology kind of specialty, people should be doing that procedure regularly and they become experts. So experts are actually in those kind of foundations, and people are actually diverted to those kind of specialties. So setting up a standalone unit and clicking would become difficult. So you have to go to some kind of foundation, stay there for 5 to 10 years. After getting a solid skill, then maybe you can start your own setup and slowly grow that. That would be one way. Otherwise, the salaries are little lesser. Next specialty would be psychiatry. So psychiatry, many people are requesting me to do a video on psychiatry. I am calling a proper psychiatrist who is working in a tier 2 city in India, and I'm doing that video. Okay, I know a lot of people are requesting that. So before that, I would like to tell you how there are like 7 to 8,000 psychiatrists are there in the societies, but around 9 to 12,000 psychiatrists would be there in this country. Okay, mental health disorders are increasing, and they will have a prevalence of 5% in India at present. And in future, the prediction is that 50 million people in India would suffer with psychiatric disorders. So there would be demand for psychiatrists in India. Okay, it is also a very good specialty with work-life balance. Next is radiation oncology. So radiation oncology is a specialty where they put radiation for cancers. So here the thing is, like, you don't really have an OPD, but you will be in touch with patients. My brother is a radiation oncologist, so I know that he'll have his OPD where he treats his patients, he sets up his radiation. But the only thing is, patients would be referred from oncologists. Directly they wouldn't come to you. So a surgical oncologist or a brain tumor neurosurgeon or some others, gynecologist who's operated a gynec onco case would refer patients to you. But once they come to you, you'll have a very good interaction with them. At the same time, night duties wouldn't be there. So it is a pretty good specialty. And the advantage with this specialty is that only 3,500 to 4,000 people are there in country. So unlikely that it will get saturated. But here the problem is that what my brother says is number of centers are also very less. And each center can be managed by 1 or 2 people. So this number also might saturate the specialty. So that is the problem with radiation oncology. But more and more centers are coming. And let's hope that more cancer centers might come in future, which would give a lot of jobs to radiation oncologists. But the incidence of cancer is going up. Around 1.3 million new cancers are being diagnosed annually across the globe, and then in India 2.7 million people are living with cancer at present. So you have a very good scope, but the thing is that one person can actually treat 50 to 100 patients in a day. So that is the problem with this specialty. Next is family medicine. So it is a upcoming specialty in India. So then, so you have a work-life balance, no night duties, and it meets the criteria, but it is an upcoming specialty. You have to. It depends on you. There are very successful family medicine doctors in Bangalore, and I would get some of them as podcasts in the channel in future. But it will go up in future because GP practice is the trend going on in other countries. India also might go into that kind of trend. Only 5 to 7,000 people are there in all the societies, but people are actually practicing like GPs and all that. Around 30 to 35,000 would be there in India doing similar kind of practice. So vast majority of people would require GP practice. So if you calculate the number of patients who require family medicine, there is a whole India. There's like 1.3, 1.5 billion people would be requiring. Just joking, but the thing is like everyone would require family medicine people in future. So next specialty with good work-life balance would be physical medicine and rehabilitation. So physiotherapists would be working under you, and in AIIMS if you do, it is a very good hospital, and you get a very good experience. After that, if you want to do neuro rehabilitation, IMANS is a good place to get trained. Around 2 to 3,000 people are there in India, which is not at all enough. You need more people because a lot of strokes, spinal cord injuries, musculoskeletal disorders, and cardiovascular rehab is coming, and respiratory rehab is coming. So many rehabs are coming. Okay, 15 million people in India will require rehab at present. So we require more and more people in India. But the only problem is that a big corporate hospital can be managed by 1 or 2 people by hiring physiotherapists under them. So it is not like if a hospital would require 30 to 40 rehabilitation specialists, like how anesthesia, critical care, emergency medicine, people will be hired in bulk numbers. That kind of hiring wouldn't happen. 1 or 2 people will be taken for a big hospital. That's it. So in that way, if you see, it can saturate with 10 to 15,000 people in India, but if you are planning to make your own setup with collaboration with a neurologist or a neurosurgeon or orthopedician or something, it's a very good specialty. And robotic rehabilitation, those things are also coming up. So you think about rehabilitation also. Geriatric medicine, just like family medicine, same rules will apply here. You will be seeing aged people. Very few people are there in India. Around 1,000 to 2,000 people are there. That's it. And I told you in my previous videos also, around 100 million elderly Indians will be there in few years. So everyone will require geriatric care. But here there is a lot of gray zone. Geriatric patients, at present, it's not mandatory that they will go only to geriatric medicine people. They would go to organ-specific specialties like pulmonology, cardiology, neurology, and all that. And if it's a bone problem, they would go to orthopedicians. And there is overlap with internal medicine. There is an overlap with family medicine. So that is a problem at present. But let's hope it will get better in future. Next is infertility medicine. So in India, infertility is increasing because of stress, pollution, and other factors. 10 to 15% of couples are having infertility, it seems, according to statistics. So what happens is around 27.5 million couples in India is estimated to have infertility. A lot of scope is there, and but the thing is, it's a super specialty. After gynecology, you have to do fellowships, and then you will be trained in infertility. So think about it. Regular gynecology is not a work-life balance. You will have a lot of night duties and all that. But if you enter infertility, you will have work-life balance. Okay, think about it. Okay, very, very good, wonderful specialty. So coming to super specialties, endocrinology is a specialty where you will not have night duties, and very few people are there in India, around 1,000 to 1,500 people, and in the society there, in the main society of theirs, only 1,200 people are there. And they cover thyroid disorders, diabetes, and all those conditions. So what I feel is India needs a lot of endocrinologists, I think, in future, and because the incidence of the disease, if you take diabetes, it will be like crores in India. So if you think about post MD and MD general medicine, endocrinology will be a wonderful option if you really take up in future. Very less people, a lot of incidence of the disease in future, and very less chances of getting saturated. So think about it. Rheumatology also, same rules apply in rheumatology, the real rheumatoid arthritis, osteoarthritis and all that. So at present only 700 to 800 people are there in India, very less number, mainly concentrated in the cities and metros. So but there are 15 million people suffering with rheumatology problems in India, and in tier 2, tier 3 I don't think anybody will be there. So if somebody is doing rheumatology and going to tier 2 cities, they will make very good practice and very good service to people in tier 2 and tier 3 cities. So all the tier 3 cities would be coming to tier 2, and you can actually build a very good practice in this. So these are the specialties I feel where we don't have night duties, and you can have a work-life balance, and then you can actually have good patient interaction also. So that's the video, guys. If you have come till here, there is a small link for a survey which I am collecting regarding stipends to help the students for counseling. I got around 250 responses, so 250 colleges data I have. In that, if you remove the repetition, maybe 170 to 180 colleges data is there. So I'll wait for another week's time and I'll release the video by August end. And I request all of you to fill that survey. It is there in the description, and then it will help a lot of students. I'm doing all these videos to do service to all the medical students of India and globally. And a lot of people are putting comments saying, why are you doing these videos and all that. I don't understand why they're doing that. Anyway, so I think it will help at least some people. So thank you guys. Thank you very much for following the video till now. As usual, Dr. Dheeraj Basapu logging off. Roger that.